Hello everyone, today we will talk about the auricular acupuncture therapy. Also, we could call it ear acupuncture. Firstly, let's learn the concept of ear acupuncture. What is auricular acupuncture therapy? Auricular acupuncture, often referred to as ear acupuncture, is probably the best known microsystem of acupuncture treatment. It involves the stimulation of specific points on the auricle, front or back side with small filiform needles, intradermal needles, or small pebbles, often the vacuole seeds that are tipped on the points. Sometimes we can use fingers to press the auricular points, and it can have some preventive and therapeutic effects for the human body. So, what are the characteristics of ear acupuncture? This therapy has a wide range of indications. A good therapeutic effect, convenient for everyday use and easy to perform, safe and no side effect generally. Since auricular acupuncture has so many advantages, what is the principle of it? In fact, according to the basic theory article of traditional Chinese medicine, auricular acupuncture therapy is closely related to meridian and visceral function. For the meridian, the channels of the hand taiyang, hand shaoyang, foot shaoyang, and the collateral of the hand yangming enter the ear. The channels of foot yangming and foot taiyang travel to the front of the ear and above the ear respectively. Besides of this, the divergent channel of the hand jueyin comes out from the back of the ear. The ear also has close relation with zangfu organs as well. According to records in Neijing, the ear links to the 5 zang organs physiologically. In Li Zheng An Mo Yao Shu, the back of the ear is divided into 5 parts that correspond to the 5 zang organs respectively. The next part is the key part of our content. It is about the anatomy of the auricle. We need to master the ear points from the anatomical level, so that we can learn the location of the ear points more clearly. From the anatomical level, we can divide the ear into 8 areas. Now, let's study the positions of the 8 areas respectively. The first part, namely helix. It is the orange area on the picture, the curved rim of the auricle. Then we call it antihelix, the elevated part of the auricle, opposite and roughly parallel to the helix. It is the light blue area on the picture. Scapula is a narrow curved depression between the helix and the antihelix, the yellow area. Triangular fossa, the triangular depression between the superior and the inferior crus of the antihelix, which is shown by the green area. Auricular concha, the depression inside the auricle, around the external auditory meatus. The concha is divided into 2 parts. The cyber concha, which is located above the crus of the helix, and the crumb concha, which is located inferior to the crus of the helix. It is the purple area in this picture. Triggers is the red one in the picture. It is a curved prominence in front of the external auditory meatus. It is easy to understand that the location of anti-triggers. It is the pink one in this picture. The prominence opposite to the triggers and superior to the ear lobe. Finally, the ear lobe, the lowest part of auricle, which is shown by the dark blue in the picture. Okay, now we have learned the anatomy of the auricle. So next, let's learn the distribution of auricular points. Auricular points are the specific areas distributed over the ear. The distribution and general location of auricular points is based on the concept of an inverted fetus map on the external ear. This view, which originated from the work of a French physician, is very useful to locate the auricular points that correspond to diverse body structures. For instance, points related to the portion of the hand located on the ear lobe. Points related to the upper limbs are located on the scapula. Points related to the trunk and lower limbs are located on the body of the antihelix. Points related to the organs in the abdomen are located in the culm and cyberconchor. So master the distribution of ear points, which can help us to select the points during treatment. And the positions and the indications of auricular points will be explained in the next class. Thanks for listening.